Todd's Carpet and Tile Cleaning. Call or text 702-595-0488.
This month is Seasonal Affective Disorder Awareness Month, but many might be wondering just what even is Seasonal Affective Disorder. Well, Seasonal Affective Disorder, or SAD, is a type of depression that happens during certain seasons of the year, most often during fall or winter. According to an article from hopkinsmedicine.org, a site for a school of medicine based in Baltimore, Maryland, it is believed that a chemical change in the brain occurs due to the shorter days and less daylight. However, even though it is most believed to occur during fall or winter, there are two patterns of seasonal affective disorder: a winter pattern SAD and a summer pattern SAD. Winter pattern SAD symptoms include oversleeping or hypersomnia, overeating, particularly with a craving for carbohydrates, which can lead to weight gain, and social withdrawal or a feeling of hibernating. Summer pattern SAD symptoms include trouble sleeping or insomnia, poor appetite leading to weight loss, restlessness and agitation, anxiety, or violent or aggressive behavior. According to the National Institute of Mental Health, it is estimated that millions of Americans experience SAD, although many may not know they have this common disorder. In most cases, seasonal affective disorder can begin in young adulthood. Seasonal affective disorder is much more often found in women than so in men, and winter pattern SAD is more common than summer pattern SAD. SAD tends to be more common for people who already have other mental disorders, such as attention deficit, hyperactivity disorder, eating disorders, anxiety disorders, depression, bipolar disorders, and panic disorders. Now that you know all of this information, and you think you may have seasonal affective disorder, what can you do about it? The National Institute of Mental Health recommends 4 kinds of treatments for people suffering from SAD. The first is light therapy. Light therapy has been a treatment for winter pattern SAD since the 1980s. This treatment involves sitting in front of a very bright light box of approximately 10,000 lux every day for about 30 to 45 minutes. This is typically done first thing in the morning from fall until spring. While this is a safe treatment for most, people with certain eye diseases or taking certain medications may experience increased sensitivity to sunlight and may need to use alternative treatments. Consult with your doctor before trying this treatment. Psychotherapy. Psychotherapy, which is just a fancy way of saying regular therapy, can help those with seasonal affective disorder by teaching new ways of thinking and behaving, as well as changing the habits that can contribute to depression. You can learn more about psychotherapy by visiting nimh.nih.gov. Antidepressant medications. Medications used for treating depression, or antidepressants, can be effective against seasonal affective disorder when used alone or in combination with talk therapy. According to the National Institute for Mental Health, antidepressants work by changing how the brain produces or uses certain chemicals involved in mood or stress. However, you should not use antidepressants unless it is specifically prescribed to you. Keep in mind as well that antidepressants do not instantly take effect. Lastly, the most simple way of treating seasonal affective disorder, specifically winter pattern SAD, is by taking vitamin D supplements. This is due to many of those who experience winter pattern SAD also have a vitamin D deficiency. However, the National Institute of Mental Health have noted that studies using vitamin D as a treatment for seasonal affective disorder have been very mixed in results. Some studies indicate that the treatment is as effective as light therapy, while other studies seemingly find no effect. Always be sure to talk to a healthcare provider as well before attempting something like this as well, as vitamin D can interact with other medications you could already be taking.